name is Schlieter. I'm working at the Technical University of Dresden in a research group for digital health. We are mainly dedicated to the more applied oriented research, and we do this since 14 years. So with my two slides I brought with me, I just want to reflect a little bit my personal experience doing research in this environment, and maybe also talking about why the things are so hard to bring it into place, to make it happen. So just maybe very short, two short stories from projects we run in the past. One was we set this digital ecosystem before the electronic health record was in place in Germany. Everyone said, yeah, we need integrated electronic case record, personal health record, electronic health record, and several projects started in the regions to try to build platforms which provide a service layer where you can exchange data, where you have messaging services, where you have telemedicine services, and you can use this, integrate this in different scenarios. So we were part in one of these as a research partner in one of these huge platform projects. The platform was funded with a lot of millions of euros. After 4 years, it was highly interoperable on the paper. So also technology-wise, it was interoperable. So all the CDA and IHE standards were fulfilled on a technical level. And then this was in place, and no one wanted to use it really, because they never thought about the business model, which is behind to have this platform in place. It was a little bit like buying this product, funding this, and then put this in a university hospital. And university hospital said, where you don't have the mechanisms in our regular payment scheme to pay for things that are integrated care scenarios, which are provided by this kind of a platform. And at the end of the day, it was the case that we run 3 or 4 additional projects on this platform, but at the end it was more or less not the technology, it was more or less the preparedness of the system and the regulations and the reimbursement schemes around this idea, which hasn't exist, and so we failed. This project failed in this environment. Another project, and I'm saying this because as a young researcher, you be very enthusiastic and in doing things. You talk with people in the hospitals and say, well, we have the tools, we know how to fix this, we can transfer data securely from one point to another point, we know the digital standards and so on, it's no problem, we can make the proposal, and then we write the proposal, and then you work with a company which maybe has a legacy product in the field, and then sits at, and we can go to them and we say, you have to implement HL7 fire profile for this, because if you don't do this, you are not interchangeable. You would fix the hospital to your solution, and no one can probably connect with other scenarios, with other use cases to your solution. So what we said to them is, we as a technical partner in this team, you need to implement this process. It was the first time they heard about this, and they spent half a year just to understand the mechanism and the idea behind the HL7 fire, and then how to implement this in their environment. So I would say also from the research side, and even if you are quite enthusiastic, it's really hard to navigate through this ecosystem, because research should work empirically. So I put this on a slide. This is a meta review we did on the barriers, and this tech cloud here this word cloud in the middle just emphasized the main barriers found by this two papers I put here in the bottom line. The story is 98 barriers have been found in this study 4 years ago. I don't think that they changed too much, but you see, if you do this in a scientific way and just read papers which reflecting on barriers for digital health adoption, for digital health success, there's a plethora of factors that can hinder you doing the right things. It starts with, we've worked out 3 categories: people-related factors, so people are not willing to adapt, the healthcare providers are not ready to change, object-related factors, technology issues, or process-related things that are related with the legislation, for instance, and so on. So these barrier gains, atmosphere, I would say, of uncertainty, and for research, it became really hard to argue that the time of evidence and time of market of research results could be supported properly. So yeah, I have to end up because the time is running out. Just four words at the end regarding what we need or where we have to further work on business models which support the transfer of research innovation into the regular market, to understand that digitalization is a multi-professional task, and we need these playgrounds he spoke about, where we can also try to do things running and then show that they can have an impact on the regular care. So thank you for the time.